In men with prostate cancer who have advanced disease, many times the cancer spreads to the bones. That is called a bone metastasis. And historically, these men have been discouraged from exercising. Many doctors for decades have been telling men with prostate cancer who have bone mets to not exercise in fear of bone pain or even breaking of bones, so bone fractures. Is that true? What does the science say, and how can you exercise if you have bone mets? Let's look at it. Actually, up to 80% of men with advanced prostate cancer have bone mets, and that corresponds to around 65 to 75% of all men with prostate cancer. Those metastases cause sclerotic lesions, primarily in the lumbar area or the pelvis, and those can result in bone pain, bone fracture, hypercalcemia, so that's when you have too much calcium in your blood, and also nerve compressions. So you might be wondering if it's safe to exercise, if there is danger to load a bone and break it. Well, by the end of this video you will know if there were any scientific studies using exercise in men with prostate cancer with bone mets, if it's safe to exercise, what the science says, and I will tell you if you have bone mets, what to do in terms of exercise. A study from Edith County University looked at 20 men with prostate cancer and bone metastases after 12 weeks of resistance exercise, weightlifting. These men were taking ADT and they took part in a combined program of resistance exercise and low intensity aerobic exercise. In just 12 weeks, they got 11% stronger and they got plus 4% lean mass, especially in their limbs, their arms and their legs, which is a very bad spot, especially if you're taking androgen deprivation therapy. That's where most of your muscle goes away. So not only being able to preserve the muscle, but actually build muscle, and actually 4% is not a small thing in just 12 weeks. It's a quite big change. That's massive. But most importantly, there were no bone fractures, there was no bone pain, and there was no difference between the control group that did no exercise and the exercise group in terms of bone pain after a session that would affect them doing their daily tasks. On top of that, they got stronger and they got more muscle, which is extremely important, especially when you're taking therapies like chemotherapy to have muscle mass on you. Otherwise, you can get toxicity. Muscle is not just to look good. Now, how did they exercise? Did they do anything differently? They had the men do a CT scan or take one from the doctor, and then they were exercising around their bone metastases. If the men had a metastasis in the pelvic floor area, they would do knee extensions and knee flexions and work out their entire upper body, but they wouldn't do any leg press or anything that involves the hip. If the men had a metastasis in their lumbar spine, they wouldn't do any abdominal exercises or trunk exercises, but they would work out their upper body and lower body normally. If the men had any metastasis in the thoracic area or the ribs, they would again avoid any abdominal exercises, and also for the upper body do only elbow flexions and extensions. They wouldn't do anything that involves the shoulder, such as chest press or low row. If they had a bone mets in their femur, they would still do knee extension and flexion and just avoid working out the hip. Finally, if the men had widespread bone mets, they would avoid doing any trunk exercises, anything that involves the hip or the shoulders, and just focus on knee and elbow flexions and extensions. Still, however, their resistance exercise program was heavy, so they were doing 2 to 4 exercises of 8 to 12 repetitions to failure. And when I say failure, I mean technical failure, which means that you're not able to do one more repetition with correct technique. So yes, they were pushed to the limit, and it's safe to do so if you're not loading the bone that has the metastasis, if you're working the rest of the body. If you want to help spread this video to those who might need it and help raise awareness, if you click the like button, it's gonna help with the YouTube algorithm. Thank you. Now, in another study from the University of North Carolina, They had 22 men on both androgen deprivation therapy and androgen receptor inhibitors, so ASRIs, do a 12-week home-based resistance exercise program using elastic bands. 88 to 90% of these men had bone mets. There was again no fractures, no pain, no bone pain, and these men actually increased their thigh cross-sectional area, so you could say their muscle mass, by 22%. How crazy is that? Safe to exercise and huge benefit, even if you have no testosterone and then additionally ASRIs that further reduce the effectiveness of any androgen hormone that you have in your body. All that can be done without any pain or any fractures, plus it will actually help you build the bone as well. So exercise, and especially resistance exercise, helps strengthen the bone so you can actively fight back against the metastases. Well, it has been shown that after cyclic compressions on a bone with bone mets, and those compressions can imitate the ones you get from exercise, there is an up to 80% reduction in bone mets growth, so actually 80% reduction in cancer growth in the bone, and also a reduction in the osteogenic dysregulation, which means that the slow decay that the mets causes in the bone is actually reduced. So exercise is one of the best things you can do if you have prostate cancer with bone mets or any cancer with bone metastases. So not only you can strengthen your bones with exercise, but you can stop the growth of the tumor in the bone. Plus, by increasing your strength, just like these men did by 11%, actually can help you improve your balance. So, especially if you have bone mets, if you fall down, you might be at an increased risk of fractures. But if you have greater strength, not only you have better ability to support yourself, but also better coordination and better balance. So that's a massive as well finding. What I would suggest for you is go to a gym, go to your local classes and talk to the trainer, tell them that you have bone mets and that you would like to avoid any exercises that load the specific places that you have bone mets, the specific locations. You can get those specific locations from your doctor if you ask your CT scan and you ask them to write you a letter so you can present it to your exercise trainer. You can work out just fine if you're not loading the actual location of the mets. You can do some low intensity aerobic exercise such as cycling or maybe treadmill walking, especially incline walking, something that will not load the area. And you can do resistance exercise, which will help you increase your strength, your muscle mass, and all the other benefits that I'm talking about by avoiding the location of the mets. And even if you're not engaging that specific bone, the molecules that are released from exercise and from the other bones that are working out will actually travel and go to the bone with the bone mets and help it fight the cancer and strengthen. Another tip that I'm gonna give you for exercises using resistance is that you should actually go a bit slower than your peers. So going up, lifting the weight 2 seconds and coming down 4 seconds, and making sure that you feel the exercise on the muscle. You put the muscle to take the punishment, okay? You're not being lazy and sacrificing technique to load the bone or a joint. No. Here we want to focus on safety first, so make sure the muscle moves slowly and it's taking all the punishment. You're not sacrificing technique ever. Now, if you found this video useful, you can buy me a coffee using the link in the description. And if you want to find actual exercise medicine programs to fight the cancer and reduce the side effects of the cancer treatments, please check my channel. I'll see you guys next time. Let's exercise!